All right, now we're going to talk about breast and some benign breast problems. Fibrocystic breast changes used to be called fibrocystic breast disease. It's now known to be very common. It can become symptomatic for some people. And what that means is just that some of the tissue, the breast tissue, is very lumpy and tender. Sometimes a single cyst occurs, but usually it's clusters or multiple small cysts. The symptoms develop in the luteal phase. So after ovulation, they tend to get worse until menstruation, and then they're relieved. The pain decreases, the swelling decreases until about a week after menstruation begins, when they start to enlarge again. They often feel like P's or BB's. Single cysts may need to be evaluated for cancer. Some people think that cystic changes may actually mask cancer and make it harder to find breast cancer. Management, good supportive bra can help with the pain. NSAIDs, heat or cold, oral contraceptives can help. If it's severe, there are some meds that actually suppress the hormone changes. Those are going to affect ability to conceive right now, but they can suppress those symptoms. For some women, this can be severe enough to cause a change of 1 or 2 cup sizes through the month. They actually have different size bras for different parts of the month because the swelling is so severe. Some alternative therapies that may be used, and there's not a lot of evidence for any of these, but some of them are used and people report anecdotal success. Eliminating caffeine, chocolate, and tobacco, a low-fat diet, decreasing sodium, using natural diuretics, or taking evening primrose or vitamin E. So those are some things that some people have reported that they found helpful, but again, research has not really showed them to be helpful. One thing to know is evening primrose definitely should not be taken during pregnancy. Another benign breast problem that we may see is fibroadenoma. It's a benign tumor. This is a single tumor where the cysts are usually multiples. It's common in younger women. It doesn't change in size during the menstrual cycle, but it may actually get bigger during pregnancy, and it may decrease in size with aging. It should be evaluated. Any lump in the breast should be evaluated to make sure that it's not cancer. It may be evaluated by fine needle aspiration, and then it's just monitored for changes. Nipple discharge is another breast problem that's pretty common. It's usually benign. It tends to be more likely to be benign if it's bilateral, it's both nipples. If it's coming from just one nipple, it's more likely to be pathologic. So Galacteria is bilateral milky discharge. This is producing what appears to be milk when someone is not lactating and haven't recently had a baby. It's associated with some endocrine disorders and some medications. It's normal in pregnancy. It's normal to start producing some milk during pregnancy. Nipple discharge can occur with some cancers and some other breast disorders. It is more likely to be pathologic, which means more likely to be some sort of disease. If it's on one side, if it's a weird color, weird as in not white or yellowish. If it's spontaneous rather than elicited. And what that means is if it just drips out on its own. Elicited means if that person tries to squeeze out some drops, they can get it. So nipple discharge is not uncommon. Usually doesn't mean cancer. One-sided colors, or if it comes out on its own, it needs to be evaluated further. Mammary duct ectasis. This is another benign breast problem. It's inflammation of the mammary ducts. It's the most common in women around menopause. It may cause a discharge from one nipple that's thick, sticky, white, brown, green, or purple. The person may feel an itching. They may feel a palpable mass behind the nipple. They may feel itching or burning in that part of the breast. It needs to be evaluated to rule out cancer, to culture it in case there's infection. And then to manage the symptoms, they may actually remove that duct if the person doesn't have plans to breastfeed in the future. that this usually happens around menopause, so it's less likely to affect breastfeeding. Intraductal papilloma. These are benign tumors that are too small to be palpated that are located within the duct. It may cause a serous, serosanguinous, or bloody drainage. Again, that would usually be from one side. It should be evaluated to rule out cancer, and then the affected duct is removed. Okay, so those are some benign breast problems. Now I want to talk about risk factors for breast cancer, because with younger women, and we're dealing mostly this semester with younger women, we're concerned as much about risk factors as we are about treating the cancer, because breast cancer is more likely to develop with aging. So we have modifiable and non-modifiable risk factors, okay? Non-modifiable risk factors means we can't do anything about them. Modifiable risk factors means that something might change them, okay? So some things that make breast cancer more likely. Non-modifiable first are age, a history of breast cancer, a family history, especially if the mother or sister developed breast cancer. And that's even higher if any of them were premenopausal. In fact, I was taught when I was in nursing school, before we knew about the BRCA gene, I was taught that if your mother and your sister have breast cancer, your risk is about 100% of developing breast cancer in your lifetime. Now they can look for the BRCA1 and BRCA2 genes. Anyone with a history of ovarian, endometrial, colon, or thyroid cancer, breast tissue that's very dense, early menarche, means an early period, late menopause, that means, so the time that you spend in your life having menstrual periods, that affects your breast cancer risk. Previous history of benign breast disease with epithelial hyperplasia, and being Caucasian. White women have the highest incidence. However, Black women are more likely to die from breast cancer. And I don't know the stats on other ethnic groups. I just happen to remember that one. Modifiable risk factors. These are things that the person might have some effect on. Nulliparity or later first pregnancy. So someone's never had a pregnancy or had a late first pregnancy, they're greater risk for breast cancer. Not breastfeeding. Breastfeeding reduces the risk of breast cancer for that patient. Not having been breastfed. Not only does breastfeeding reduce the mother's risk of breast cancer, but it reduces that child's risk of breast cancer. Postmenopausal combined hormone replacement therapy. So if someone is postmenopausal and they're taking combined hormone therapy, that may increase the risk. Obesity after menopause, alcohol more than 1 drink per day, a sedentary lifestyle, vitamin D deficiency. So those are modifiable risk factors. So when we're teaching our patients who have a lot of non-modifiable risk factors, we want to really have them screening so they can catch it early if they develop cancer. But we also want to teach everyone how to modify those risk factors. Okay, and we're going to come back for one more very short section, and then this lecture will be done.